Hi, I am Dr. Arsalan and in today's lecture we will study the pneumonia, its causes, transmission, stages, signs, symptoms, diagnosis, treatment, as well as the vaccination against pneumonia. So first of all, we will define the pneumonia. It is the inflammatory condition of alveoli of lungs. Basically, pneumonia is associated with the inflammation of alveolar wall of the alveoli. Inflammation of alveolar walls of alveoli. And as we know that the alveoli are structural and functional unit of the lungs, so lungs perform the function of exchange of gases through the alveoli. And if these alveoli are inflamed, this condition is called pneumonia, and it's a respiratory tract disease which badly affects the lungs as well as the respiratory tract. Now, etiology or causes. Etiology is also called as causes. There are more than 100 strains identified to cause pneumonia, and these may belong to virus, bacteria, fungi, or parasites. We have written these pathogens separately. First one, the bacteria. The Streptococcus pneumoniae. This is the most common and most prevalent bacteria which causes the pneumonia, and 50% cases of the pneumonia are associated with the Streptococcus pneumoniae. This is a gram-positive bacteria, spherical in shape and non-motile. The other bacteria are Haemophilus influenza, Mycoplasma pneumoniae, methicillin-resistant Staph aureus, methicillin-resistant Staphylococcus aureus bacteria, and Chlamydia pneumoniae. These are the bacterial causes of the pneumonia. Moreover, the pneumonia may also be caused by the viruses. For example, the rhinovirus, coronavirus, influenza virus, respiratory syncytial virus. This is the respiratory syncytial virus. Adenovirus, parainfluenza, as well as the herpes virus may cause viral pneumonia. Then the fungi, Histoplasma capsulatum, Cryptococcus neoformans, Coccidia, and Blastomyces. These are some important fungal causes of the pneumonia. And this pneumonia caused by the fungi, this is called fungal pneumonia. Fungal pneumonia. Some parasites do cause the pneumonia. For example, Toxoplasma gondii, Ascaris lumbricoides, or Plasmodium malariae. So these are the names of some important pathogens which cause pneumonia, including the bacterial, viral, fungal, as well as the parasitic classes. Now we will discuss the pathogenesis of pneumonia. Pathogenesis means the developmental stages of the infection or disease. Here we will discuss the separate pathogens of bacterial as well as the viral pneumonia. In case of bacterial pneumonia, the bacteria enters the body through respiratory tract, and its route of transmission is airborne or droplet transmission. The bacteria enters the body and multiply in the throat and reach the lungs. In the lungs, the bacteria start multiplication in the spaces between the alveoli and infect the lung parenchyma as well as the alveoli and cause their inflammation. So the pneumonia occurs. In case of viral pneumonia, the virus enters by airborne transmission or droplet transmission, and it reaches the lungs. When the virus reaches the lungs, it invades the lung parenchyma as well as the alveoli. The structural and functional unit of the lungs are the air sacs. The virus starts multiplication in the alveoli as well as the lungs parenchyma and infect them. But this virus is subjected to the immunity attack or the attack of the white blood cells or immunity on these virally infected cells. But this attack of the immune system of the body, it is more dangerous and cause more damage to the lung parenchyma and the alveoli and cause the cell death. The exudates are released from these died cells and accumulate in the lung alveoli. Consequently, it causes the inflammation of the alveoli or pneumonia. Now we will discuss the stages of pneumonia. There are 4 stages of pneumonia: the congestion, red hepatization, grey hepatization, and resolution stage. The first stage of congestion starts during the first 24 hours of the infection. Congestion means increase in blood flow, increased blood supply or blood flow. During this stage, the blood flow is increased just as the immune response, so that the immune cells or white blood cells may reach the infection site. Second stage is red hepatization. Red color of the lungs is due to congestion. Hepatization means the lungs look like liver. So it occurs during the first 2 to 3 days. The lungs are dry, granular, airless, and hard and resemble to the consistency of the liver. Therefore, it's called red hepatization. The gray hepatization means the gray is the color of the lungs, and hepatization means consistency is just like the liver. During the first week of infection, the lungs look like yellow or gray in color, and the consistency is still like the liver. The lungs are firm and hard. The final stage is resolution stage. It occurs after 10 days of the infection. During this stage, there is recovery stage, and the lungs attain their normal position and shape as well as the consistency and the functions. The exudates produced in the lungs are absorbed by the blood. The cell debris, the neutrophil cells, as well as the microorganisms or pathogens, these are killed and are absorbed by the macrophages. Alveoli return to the normal state and the body recovers. Now the transmission of pneumonia. Pneumonia is airborne disease and it is transmitted through respiratory tract. For example, the air droplets from the infected person through coughing, sneezing, breathing or exhalation, or spitting. So these are the main sources of transmission which are spread through respiratory tract of the body from infected to healthy person. Next is diagnosis of pneumonia. It may be diagnosed by radiological procedures. The radiological procedures including chest X-ray, in which the lungs condition can be revealed, the CBC or complete blood count, in which neutrophilia will occur or increased number of neutrophils. Pulse oximetry. Pulse oximetry can be determined through a device called pulse oximeter, which shows the oxygen saturation of the body must be 97% or more in normal conditions, but in case of the pneumonia it will drop from 95 to 90%, revealing the hypoxia, deficiency of oxygen in the body due to malfunction of the lungs. Next is the C-reactive protein. C-reactive protein means creatinine reactive protein, and it is always elevated in case of the inflammatory reactions. The sputum test for the culture of the bacteria, CT scan, computerized tomography scan, MRI, magnetic resonance imaging scan, these are radiological procedures. The culture of the sputum, as we discussed earlier, and the clinical signs. Now the important clinical signs associated with the pneumonia. There is productive cough in which there is sputum, and sputum is of green, yellow or rusty color. Chills due to high grade fever. Fever may be more than 100 degree Fahrenheit, up to 104 Fahrenheit. There is dyspnea. Dyspnea means difficult breathing because the lungs have been inflamed. Chest pain due to lungs inflammation. Fatigue due to hypoxia or deficiency of oxygen in the blood. Anorexia means loss of appetite. And wheezing sound is produced in the lungs, and as a complication there is lung abscess, and if the pneumonia is complicated there is lung abscess formation which is associated with the convulsions. The treatment regimen of the disease is it is based upon the three principles. First is the administration of antibiotics, then the anti-inflammatory and symptomatic therapy. The antibiotics given are azithromycin 500 mg once daily for 10 to 14 days. This works best against the bacterial pneumonia as well as the viral pneumonia for the prevention of secondary bacterial growth. Anti-inflammatory given are paracetamol to reduce the fever, ibuprofen or diclofenac sodium. Piroxicam can also be given as anti-inflammatory. Symptomatic therapy is, as you know that there is productive cough, so antitussives are given. Antitussives are the drugs which reduce the cough. The multivitamins are given because we are administering the antibiotics for a long time. So this antibiotic therapy will also kill the useful bacteria which will not produce the vitamins for the body, for example vitamin B and vitamin K. So we will also include the multivitamin in the treatment regimen. Rehydration therapies. So this is the treatment protocol of pneumonia. The best way of protection from the pneumonia, it is the vaccination or immunization of the general public, and for this purpose pneumococcal vaccine have been developed by WHO and UNICEF brothers. WHO and UNICEF has made available the pneumococcal vaccine all across the world. And finally the aspiration pneumonia. Aspiration pneumonia is a separate condition. Aspiration means breathing, or we can say the breathing of solid or liquid object into the lungs which cause the inflammation of lungs or pneumonia. It may be defined as it occurs when the food or liquid it is breathed into the lungs accidentally. For example, the food material or the liquid it is passed into the respiratory tract rather than the digestive tract. This causes the aspiration pneumonia. This food and liquid, this act as foreign material in the lungs and it hinders the normal functioning of the lungs. Moreover, this aspiration pneumonia it is severely infectious and may prove fatal in some cases. The risk of aspiration pneumonia is highest in infants and children. Infants and children are at high risk. The only remedy of the aspiration pneumonia is to remove that food or liquid which has passed into the lungs. It is done by the bronchoscope. Bronchoscope is a device through which these particles are removed from the lungs by means of bronchoscopy. The technique is called bronchoscopy. So this was all about the pneumonia. Hope you have learned something new in this lecture. Keep watching my videos. Thank you.